Hi, I am Dr DVL Narayan Rao, Senior Consultant Surgical Gastroenterology and Laparoscopic Surgery at Apollo Spectra Hospitals, Kondapur, Hyderabad. Now, I would like to introduce to you a topic which is a gastrointestinal bleeding. It is a very important topic for the simple reason that it can be life-threatening in many times. That's why one need to know the importance of that. When you talk about gastrointestinal bleeding, the bleeding can be upper gastrointestinal bleeding or lower gastrointestinal bleeding. Upper gastrointestinal bleeding means bleeding from the upper GI tract like stomach and esophagus, wherein patient's presentation will be like a vomiting blood vomitings. Lower gastrointestinal bleeding is usually it is passage of blood from stool. Okay, this is the gross difference one can make from the upper gastrointestinal bleeding or lower gastrointestinal bleeding. The causes of gastrointestinal bleeding are many, and one of the main important causes of gastrointestinal bleeding is liver disease. When the liver disease is prolonged, it will become a stage called cirrhosis, wherein it causes the pressure on the vessels which supply the blood from the intestines to the liver. Due to the blockage or obstruction, backflow of the blood occurs and they rupture and bleed from the gastrointestinal tract, cause bleeding. One of the important causes for this is the alcohol. Even though some viral diseases cause this liver disease, alcohol is the one thing which is very important to us for the simple reason it's a preventable disease. Whenever alcohol stoppage can occur or alcohol consumption comes down, obviously this disease can come down, because this disease is there very large numbers in our society, for which patient had to spend lot of money, and sometimes patient require in end stage liver disease even the liver transplantation. Liver transplantation facilities are very few in our country, very few centers are doing. It's a very costly operation involving about 30 to 40 lakh rupees. That's why prevention is a very important thing as far as disease is concerned. Other important causes of gastrointestinal bleeding are ulcers. These can be managed medically. When the medically they cannot be controlled, surgical management can be done. In all these cases, when the medically it cannot be managed, surgical disease can be done. Lower gastrointestinal bleeding is very important, because especially lower gastrointestinal bleeding, common thing is the piles or hemorrhoids. Piles or hemorrhoids are easily treatable disease. They can be treated by any general surgeon. This is common problem and easily treatable any small clinic. But I am not stressing on that. I would like to stress on the lower gastrointestinal bleeding, wherein the cancers which actually present as a bleeding, which sometimes you mistake for hemorrhoids and neglect it, and also sometimes without proper examination they will be treated like hemorrhoids, because hemorrhoids can be associated with the cancer. Just because you see a hemorrhoid and treat it, that is not answer for that, because cancer is a dreadful disease, and when you can treat colorectal cancers, the results are so good that almost a cure can be produced. That's why you should not leave any chance to diagnose early and treat it. That's why I definitely would like to introduce to you this topic, and gastrointestinal bleeding is a very important thing. Number one, it can be life threatening. Number two, the cause of this can be a dreadful disease like a cancer. That's why one should be very careful. Thank you.